live, and we spoke a lot about antiviral drugs. Okay, but I think I was left to like 20 drugs to talk about. So today we'll be taking time. I will be finishing those 20 drugs that we left, that we didn't talk about pharmacology. So I think there is one here that I need to make a correction. So I'll quickly make the correction, then we'll kickstart the antiviral stuff. Okay, so just one drug I need to make a correction before we go on. It's in my network. Oh, sorry. Okay, I think it disconnected from my hotspot. Right. This thing disconnected from my hotspot. Please don't be angry, right? I want to just make some one or two changes for this. One or two corrections for this. Yeah, it's up now. The network is up. In 2 minutes, I should be done making the changes. Then we'll start recording. I have 20 drugs to talk about. I think this one is what is the real pivirine. So we'll talk about the real pivirine now. Okay. I think I'm almost done now. I'm just trying to make some one or two corrections for just a particular drug. Right. So please be patient. I just want to add it pharmacokinetics, then clinical uses. Almost done. Then before we start, I want to let you guys know that the pharmacology of antiviral drugs is not as extensive as the pharmacology of antibacterial drugs. Do you understand? Antiviral drugs, most of them, they are just designed for a particular disease. Do you understand? You hardly find them being used on multiple disease. Even if it is multiple, at least 2, 3. You understand that kind of thing? So that's just the nature of antiviral drugs. I'm also uploading some videos, so I'm trying to check the progress. So please, let's start. For the first antiviral drug which you'll be looking at, this is what is known as a raltegravir. All right, raltegravir. So we look at the pharmacology of raltegravir. So for raltegravir, we say that it's an antiretroviral drug. When you say something is antiretroviral, it's used in treating HIV, and this is especially the HIV-1. It was the first integrase strand transfer inhibitor. Okay, so what's the class of the drug? Integrase strand transfer inhibitor. Mechanism: it will inhibit the HIV-1 integrase enzyme. So that enzyme is very important, so that the viral DNA is inserted into the host genome. If you stop the enzyme, of course, the viral DNA will not be inserted into the host genome. Do you understand? So to block the strand transfer step of integration, so to prevent stable proviral DNA formation. This will halt HIV replication at a very important stage to the virus. So pharmacokinetics: absorption is orally, distribution has a moderate protein binding, metabolism is via the UGT1A1, okay, that's via glucuronidation. Excretion is mainly feces, then half-life is about 9 hours. Therapeutic use is used in treating HIV-1 infections. Can you see that this drug now is just tailored towards a particular sickness? So that's how antiviral drugs are. They are just tailored towards a particular sickness. It's antibiotics drugs that are so extensive, you know. So it's used in combination therapy. You join it with other antiretroviral drugs. And the most popular brand name is what is known as Icentress. Okay. So adverse effects can cause headache, can cause insomnia, can cause nausea, fatigue, you know, sometimes can cause myopathies, rhabdomyolysis, depression, but that's actually rare. Okay, so that's it for the pharmacology of raltegravir. We'll move to the next antiviral drug. Okay, sorry. Wow, I'm just trying to see something. Okay, that didn't even record. Okay, that didn't record. So I think we'll go over raltegravir again. Okay, let's go over the raltegravir because it wasn't on record. Okay, so for the raltegravir, we'll go over it again because I have to record it. So for the raltegravir, we said that it was an antiretroviral drug. It's mainly used for the treatment of HIV-1 infection. Okay, so the class of drug, it is an integrase strand transfer inhibitor. So how will it work? It blocks an enzyme which is known as a HIV-1 integrase enzyme. That enzyme is very important for the viral DNA to be put into the host genome. Do you understand? So if you block that process of transfer, the transfer is a proviral DNA formation, all right? So it will now halt the process of the virus actually making other copies of itself. So absorption, we said, is orally, distribution, moderate protein binding of about 83%. Feces, half-life is about 9 hours. So it's mainly used in treating HIV-1 infections. So usually combining, okay? The most popular brand name is what is known as Icentress. Okay, so it's effective in treating both treatment-naive patients and also treatment experienced nausea, vomiting, can also cause myopathies and rhabdomyolysis, also depression. But those ones are rare. The last three I mentioned. We'll quickly move to the next antiviral drug. Now, for the next antiviral drug, the name is what is known as the tenofovir. Okay, tenofovir alafenamide. Okay, pharmacology of tenofovir alafenamide. So for the tenofovir alafenamide, we said that it's a modern antiretroviral drug. That means it has been newly been formed. Okay, so it's mostly used in treating what two types of viral infections. That's HIV infections and also hepatitis B infections. Okay, so it's like an improved version of the ordinary tenofovir that they used to use before, you know. So what's the class of drug? It's a nucleoside reverse transcriptase inhibitor. You see it being abbreviated as NTRTI. Okay, so it's a prodrug of tenofovir. That means if you give it to someone, it will be converted to tenofovir diphosphate. That's like the active metabolite. So it competes with natural nucleotides for incorporation into the viral DNA. Okay. Okay, so it competes with that process. So when it gets into the viral DNA, unlike the natural nucleotides, this one will now terminate the chain. Okay, it will now halt the viral synthesis. Okay, so it's used in treating HIV-1 and also hepatitis B virus infections. So pharmacokinetics, they usually are administered orally. Absorption, there's high oral bioavailability. Distribution is more stable in plasma than the ordinary tenofovir, right? So that I think that was one of the improvements. Metabolism is hydrolyzed inside the cell. It will be converted to the tenofovir diphosphate. So excretion is mainly via the kidneys. Right? Has a longer half-life too. So therapeutic uses is used for treating HIV. Okay, where they combine it with what? Emtricitabine, then bictegravir. Okay, it's also used in treating what? Hepatitis B virus infection, or you can also use it for prophylaxis. That's before the person gets exposed to that. You can also use it. So most of the times, you also combine it with what? Emtricitabine if you want to treat hepatitis B virus. So adverse effects is nausea, headache, and fatigue. There's sometimes lactic acidosis, which is rare. Okay, so that's it for the tenofovir and alafenamide. We'll move to the next drug. For the next drug we should be discussing its pharmacology. This is what is now the real rilpivirine. Pharmacology of real rilpivirine. So for the real rilpivirine, we said that the class of drug is a nucleoside reverse transcriptase inhibitor. So you see it's being abbreviated as NNRTI. Okay. Now it belongs to the diaryl pyrimidine subclass. Okay. So it binds to an allosteric site on the HIV-1 reverse transcriptase. It will now cause conformational changes, which will now inhibit the HIV-1 reverse transcriptase enzyme. Okay. So mechanism of action, it works through non-competitive inhibition of HIV-1 reverse transcriptase. It binds to a hydrophobic pockets, okay, and this is near the reverse the active site directly, but just beside it. So that's it's a non-competitive inhibition. So it will now block DNA dependent and RNA dependent polymerase activity. It will now prevent RNA from turning to viral DNA. Okay. So it does not inhibit human DNA. Okay, only the virus. Okay, so it has a good safety profile. So it's active against HIV-1. Okay, so pharmacokinetics, oral bioavailability is good. Highly protein bound, about 99%. Metabolism is at the cytochrome 3A. Elimination is mainly in feces. So they mainly use it for what? Treatment of HIV-1 patients. Those are the treatment naive patients, like the ones that are just starting. So they usually combine it with what? Cabotegravir. Okay, usually combine those two drugs in treating the HIV-1. Now, that's it for this. We'll move to the next drug. Okay. Now, for the next drug, what we have is what is known as a remdesivir. Pharmacology of remdesivir. Okay. So for the remdesivir drug, you can see that it's actually an antiviral drug. It was approved just in 2020. So we're in 2025 as at the time of recording this video, so it's not far. Okay, so we can relatively call it a new drug. It was approved for the treatment of what? COVID-19. All right. So what's the class of drug that remdesivir actually fall under? We say that it's an adenosine nucleotide analog. Okay. So it's a prodrug. Okay. When you give it to someone, it will be converted to the active drug. Okay. So the active drug is what is known as the GS 4415-24-triphosphate. Okay, so this active metabolite mimics adenosine, incorporates into viral RNAs, inhibits RNA-dependent RNA polymerase, causes premature termination of the viral RNA synthesis, right? So the whole thing is actually stopping the virus from replicating. All right. So pharmacokinetics, admission is actually intravenous. Distribution is widely distributed in tissues. Metabolism is to be converted to the active part that we earlier on spoke about. Excretion is mainly through the renal routes. 19. Okay, mainly in children that are above from once someone is not a newborn. Okay, so once a child is above 28 days upward, you can use it. Okay, so you can use it in treating hospitalized patients and also non-hospitalized patients. Okay, so that's what we got. Adverse effect is nausea, headache, and rash. They sometimes can be toxic to your liver and make the liver enzymes go up. All right, so I think that's it. I've been uploading some things, so I just want to check the progress. It's moving gradually. Okay, now we'll move to the next antiviral drug. Now for the next antiviral drug we should be discussing, this is what is known as the Vicreviroc. Vicreviroc. So for the for literature's sake, we'll talk about drugs that are showing promising, like they'll soon release them. They'll also talk about drugs that are already being released. You understand? So the drug is being studied for its potential to be able to use in treating what HIV-1. So we said that the class of drug, it is a CCR5 receptor antagonist. Okay, so how does it work? So the HIV, we are now trying to give a background story. HIV requires co-receptors like the CCR5 and the CXCR4 to be able to what? Bind on the CD4 T cells that are basically a bedrock of your immune system. Do you understand? So if you're able to stop those HIV viruses from the system, you're cool. So it binds to the CCR5 receptors on the host cells. Okay, now it will now block the receptor to prevent the HIV virus from attaching an entry and blocking. Do you understand? So it works on the CCR5 trophy HIV-1. Okay, so pharmacokinetics, you administer it orally, absorption is a good bioavailability, distribution is highly protein bound, metabolism is via the cytochrome 3A4, excretion is mainly fecal, half-life is long. Okay, so therapeutic uses is mainly for HIV-1 infections and usually combine it with other antiretroviral drugs too. So it's developed by a company known as the Schering-Plough and the Merck. Okay, so it's still under studies, but it's shown a lot of promises that very soon this drug will be put into public use. So proposed adverse effects, that's in trials, they have seen that it can cause some headaches, some dizziness, gastrointestinal upset, but it's actually mild, all right? Hence the continuity of the trials. So that's what we got. We'll move to the next drug. Now, for the next antiviral drug, we'll talk about what is known as a sofosbuvir. Sofosbuvir, right? So the pharmacology of sofosbuvir. So for the sofosbuvir, we said that the popular brand name of this drug is what is known as Sofaldi. So it's a breakthrough antiviral drug. Okay, so it was approved in 2013. So the drug was actually used in the treatment of chronic hepatitis C virus. Okay, so it's a direct it's a direct acting what antiretroviral drug. Do you understand? It was approved in 2013, hepatitis C virus. Okay, so what's the class? It's a nucleotide analog NS5B polymerase inhibitor. So it's a prodrug, okay, and the active component has a triphosphate. So the metabolite makes what? Uridine, and is incorporated into viral RNA by the hepatitis C NS5B RNA dependent RNA polymerase. So when it goes in chain termination, So the virus is not able to make other copies of itself, you know. So pharmacokinetics is usually sold as oral tablets. There's high oral bioavailability. It's widely distributed in tissues, you know. It to be converted to the active metabolites, of course. So excretion is mainly renal. Okay, excretion is mainly renal. Half-life is about just 0.4 hours. So usually dose it frequently, depending on the issue though. So treatment is hepatitis C virus infection. And you can use it from people that are above 3 years, you can use it. So they usually combine it with a drug known as the velpatasvir, okay? Velpatasvir. Then you can also have other drugs like, sorry, let me just snap this. You can have other drugs like the ledipasvir combination. So it's very effective, right? So some common side effects is headache, fatigue, nausea, and insomnia. All right. So that's what we have for sofosbuvir. For the next antiviral drug, we'll talk about the next antiviral drug we'll talk about is what is known as the telbivudin. All right, telbivudin. So for the telbivudin, you know, it has a very popular brand name known as the Sebivo. You can also see another one here on this picture known as the Tyzecar. Okay, so it's an antiviral drug. It's used in the treatment of what? Chronic hepatitis B. So just like I was telling you guys, antiviral drugs are not like antibiotics. Most of them are just designed to just tackle like a single disease condition and all. So what's the class? Is a nucleoside analog. That's an L-thymidine analog. Okay, so how does this drug work? It's actually phosphorylated, like more phosphate is added on it, okay, to turn it into a triphosphate form, which is the active form of the drug. So it competitively inhibits an enzyme known as the DNA polymerase or the reverse transcriptase. Of course, that enzyme is very important for the virus to keep making copies of itself, thereby disease progression. So if you block the enzyme, you are blocking the virus from hepatitis B virus. Don't go and use it on HIV, it won't work. Okay. Administration is oral tablet. Absorption is rapid. Distribution is widely in body tissues. Metabolism is in the liver, but minimal. Excretion is via urine, you know. Half-life is about 40 to 50 hours. So if a drug's half-life is about 40 to 50 hours, I might just want to dose it once in 2 days. Okay, because 2 days is how many hours? 24 plus 24, 48 hours. So just dose it once in 2 days. So it's mainly used, that's indication, therapeutic use, hepatitis B virus infection, chronic one. That's the one that has been resisting treatments. So it can cause fatigue, can cause headache, can cause cough, nausea, diarrhea. That's basically it. So that's it for the telbivudin. Okay, for the telbivudin. We'll move to the next. So what we have is the cimeprevir, pharmacology of cimeprevir. So for the cimeprevir, you can see that the most popular brand name here is what is known as All-Lysio. Okay, so it's an antiviral drug, and for this one, I told you guys that most antiviral drugs, they are tailored to treat just the one thing. So this one is mainly used in treating hepatitis C virus infections. It's a direct acting antiviral drug. So let's discuss the pharmacological profile. So it's an NS3/4A protease inhibitor. It inhibits the hepatitis C virus NS3/4A protease enzyme. The enzyme is very important okay, for breaking down polyproteins into functional proteins. Do you understand? So if you block the enzymes, yes, the virus is having proteins, but they are not functional proteins. So thereby, the virus can't use the proteins to grow. Do you understand? So it will now kill, it will now like halt the activities of the virus. The virus cannot be able to make other copies of itself. So pharmacokinetics is usually sold as oral capsules. Absorption is enhanced with food. Distribution is highly protein bound. Metabolism is via the liver, via the cytochrome 3A4. Excretion is primary fecal elimination. Half-life is about 10 to 13 hours. Okay, so therapeutic uses historically. So Previr is not really being. They usually used to use it before. Okay, so they withdrew it from the market. Okay, so they withdrew it to 2018. Okay, because of it's not because of adverse issues. It's because they found other drugs that were more effective than it. Do you understand? So basically, that's it for Previr. So just like I said, I'll take a 2 minutes break just to check on some things that I'm uploading. Bro, what's popping? Why is that my network seems very bad? I'm uploading things and they are not uploading quick, but fine. I'll just be patient. Probably as I'm recording to be going. Alright, so break over. Let's go to the next drug. Now, for the next drug which we discuss is pharmacology. This is another improved version of tenofovir, and it's known as the tenofovir disoproxil fumarate. Okay, tenofovir disoproxil fumarate. Now, for this one, we said that it's a cornerstone antiretroviral drug. It's mainly used in treating HIV and hepatitis B infection. So it's a nucleotide reverse transcriptase inhibitor, and is one of the most widely prescribed antivirals globally. So the drug is a nucleotide reverse transcriptase inhibitor. So the tenofovir disoproxil fumarate is an improved version. So it's a prodrug of tenofovir. If you give it, ultimately it will become tenofovir in the that's tenofovir diphosphate. Okay, so to compete with natural nucleotides to get into the DNA of the virus, but when it gets into the DNA of the virus, it will rather cause a chain termination. So it's oral tablet, is enhanced with food, is widely distributed. Metabolism is hepatic metabolism. Excretion is renal route. Half-life is about 17 hours. So if I have a 17-hour drug, if I want to dose it, I'll actually dose it like, once in a day. So pharmacokinetics. Oh, well, I've spoken about the pharmacokinetics. So it's mainly used in treating HIV-1 infection. So for the HIV-1 infection, you combine it with drugs like what? Emtricitabine, also combine it with lamivudine, efavirenz, and the rest of them. Okay, so it actually it can also suppress what? Hepatitis B virus replication. So it's used in HIV and also hepatitis B virus infections. That's what we got. So moving to the next drug, which we'll discuss its pharmacology. Now, for the next one, which we'll discuss its pharmacology, this is what is known as a tipranavir. So pharmacology of tipranavir. So for the tipranavir drug, we said that it's an antiretroviral drug. It's mainly used in treating what? HIV-1 infection. All right. So what class of drug is this tipranavir? It's a HIV-1 protease inhibitor. Okay. So it inhibits the HIV-1 protease enzyme. So it will now prevent the enzyme from breaking down polyproteins to form what? Functional proteins, you understand? So this blocks the virus from using good proteins to grow. So it will stop the virus from maturing. So you have the virus making copies of itself, but the copies are immature. Do you understand? So they usually administer it with what? Ritonavir. So that ritonavir will shield it from the body breaking it down so that it can function more. So you call that a booster dose. Call that a booster dose. So pharmacokinetics is oral, is enhanced with food absorption. Distribution is highly protein bound. Metabolism is hepatic. Excretion is mainly fecal elimination. Half-life is about 5 to 6 hours. Treatment is mainly used in treating HIV-1 infections. So adverse effects, you have things like diarrhea, nausea, vomiting, headaches, fatigue. Then it can also be toxic to the liver. Okay, so that's it for tipranavir. Quickly head to the next drug, and this one, so I didn't arrange it all, so I'll skip it. Guy, I still didn't arrange this one. I'll skip that one too. Okay, yeah, then I'll actually just go to the ones I've arranged. Now for the next drug which we'll be talking about, the name of this drug is the voxilapravir. Voxilapravir. So for the voxilapravir, we said that it's an antiviral drug. It's mainly used in treating hepatitis C virus infection. So it's a direct acting antiviral. Okay, so to block a very important enzyme. Okay, so that very important enzyme is known as the NS3-4A protease enzyme. That enzyme is very important if polyproteins in hepatitis C are to be broken down to form what? Functional proteins. Do you understand? So when you stop the formation of functional proteins, of course, the virus doesn't have proteins to keep growing and keep making copies of itself. So it will now terminate the activities of the virus, of course. So pharmacokinetics is orally. Administration, that's administration. Absorption is enhanced with food. Distribution is highly protein bound. Metabolism is via the cytochrome 3A4. Excretion is primarily through the fecal route. Half-life is about 33 hours. So indication is just mainly used in treating hepatitis C virus infections. Okay, so they usually combine it. Okay, usually combine it with velpatasvir, voxilapravir. Okay, they usually combine them like that. So adverse effects is headache, fatigue, diarrhea, nausea. Can also be toxic to the liver. Okay, so I think we'll quickly move to the next drug, which we get to talk about its pharmacology. Now, for the next drug which we are talking about is pharmacology. This is a drug that is known as a telaprevir. So we'll talk about the pharmacology of telaprevir. So for the telaprevir drug, we said that it's an antiviral drug. It's mainly used in treating hepatitis C virus infection, not just the ordinary hepatitis C virus infection, the chronic one. That's one that has been there for a very long time. So the class of drug that this telaprevir actually belongs to, and it goes by a very popular brand name known as the Incivec. Okay, so it's the NS3-4A protease inhibitor. So in the hepatitis C virus, right, there's an enzyme known as the NS3-4A protease enzyme. The function of that enzyme is to break down polyproteins to form functional proteins. So this drug will go in and block this enzyme. If you block the enzyme, the virus doesn't have functional proteins. That's good proteins for it to keep growing and making copies of itself. So thereby, you are terminating the activities or replication of this virus, So going to the pharmacokinetics, administration is orally. usually enhanced with food. Distribution is highly protein bound. Metabolism is via the liver. Excretion is through the feces. Half-life is about 9 hours. So it's mainly used for treatment of what? Hepatitis C, hepatitis C virus infection, right? So adverse effects can cause rashes, can cause pruritus, itching, right? Can cause anemia, can cause nausea, diarrhea, fatigue. These adverse effects, we're not saying it must be there. Okay, sometimes it's just, rare. Okay, tenofovir. So I think that's what we got. Then, coming. Now, I think we'll move to the next drug, which we'll get to discuss. It's pharmacology. So for the next drug which we are discussing is pharmacology. We'll talk about the drug known as stavudine. Pharmacology of stavudine, right? So stavudine, you should know that it's an antiretroviral drug. And once you term a drug antiretroviral, that means the drug is used in treating what? HIV infections. So it belongs to the nucleoside reverse transcriptase inhibitor class. That means it will block the reverse transcriptase enzyme. Do you understand? So how does it work? It's a thymidine analog, okay? And when it gets into your system, it has to be converted into its active form. The drug itself is inactive, right? So before it must be converted to the active form, it has to be phosphorylated. Phosphorylated, that means you are adding phosphate. So you add 3-phosphate, making it what? A stavudine triphosphate. So it competes with natural nucleotides. Like nucleotides are supposed to go into the DNA so that the virus will keep growing and making copies of itself. So the drug will now compete with those nucleotides. But when this drug gets into the viral DNA, rather, it will cut off the chains. For the virus to be growing, you have the DNA is a chain, right? So it will cut off the DNA of the virus, thereby terminating the activities of the virus. So pharmacokinetics, administration is orally, absorption is good oral bioavailability, distribution is widely distributed, metabolism is to be broken down in the liver, excretion is renal, half-life is about 1 to 2 hours. So that means you can dose it multiple in a day, but it depends on the condition on ground. So just like I told you guys, antiviral drugs are not as extensive as antibiotics. So most antiviral drugs are just made to tackle just one problem, one disease condition or two disease conditions. So this one is just mainly for HIV-1 infection. So it can't even act on HIV-2, just only HIV-1. Well, HIV-1 is much more popular, you know. So it's a HIV-2 that is mainly in just West Africa, so it still serves. So adverse effects can cause headaches, can cause nausea, can cause diarrhea, fatigue, then they'll write a lot of adverse effects, but it's actually rare, doesn't really occur commonly like that. Now, for the next, we'll go to the next drug and discuss its pharmacology. Now, the next drug we should look at is what is now the trifluridine. Pharmacology of trifluridine. Okay, trifluridine. There's different ways in which you pronounce it. So the drug actually goes by a very popular brand name known as Viroptic. And anytime you hear optic, they're actually talking about eyes. So definitely you can be suspecting that the drug is used in treating all those eye conditions, right? So it's an antiviral drug. It's mostly used in ophthalmology. So it's mostly used in treating eye conditions, just like I was suspecting from its brand name. So what class of drug is this? It's a thymidine analog. Okay, it's an antiviral nucleoside. And trifluridine is actually inactive. When it gets into the body, it has to be activated, so it has to be phosphorylated. So you add 3-phosphates to it to become trifluridine triphosphate. So it incorporates into the DNA, into the viral DNA. Okay, so when it gets into the viral DNA, it will now, it's like a sword. It will scatter the DNA of the virus. Do you understand? It will cause faulty base pairing and to terminate the chain. So this will now inhibit the virus from going on to make copies of itself and enjoying their self in your system. So administration is mainly eye drops, so ophthalmic solution. Absorption, you don't talk about absorption because if you put something in the eye, it will rarely get into the system. Do you understand? So therapeutic use is mainly used in treating what? Eye infections caused by the herpes viruses, like the herpes simplex keratitis, then also the dendritic what? Corneal ulcers. Okay, so mainly eye infections caused by viruses. So adverse effects can cause burning as you're putting it in the eye, stinging, eyelid edema, photophobia, you know, just some one or two things at the time being when you just put the drug freshly and all of that. So quickly move to the next drug. We're almost coming to an end. This one, so I didn't arrange it. Ritonavir, I didn't arrange it. So I think we'll go to the valacyclovir. Pharmacology of valacyclovir. So we'll talk about the valacyclovir and everything around it. So for the valacyclovir, you should know that the drug actually goes by a very popular brand name known as the Valtrex. Okay, so it's an antiviral drug. It's mainly used in treating infections caused by the herpes viruses. Anytime you hear anything, vir, okay, ritonavir, acyclovir, valacyclovir, just know that it's herpes virus. Even if there's an addition something, just know that herpes virus must be there. Do you understand? So it's a prodrug of acyclovir. That means if I give you valacyclovir, when it gets into your system, it will be converted towards acyclovir, right? So valacyclovir will be converted to acyclovir in the body. Acyclovir will further be what? Phosphorylated. You add 3 phosphates to it, making it triphosphate. That's when it becomes active and start functioning in your body. So how does it work? It inhibits DNA polymerase, which is a very important enzyme for the DNA chain to keep going on. So if you inhibit the enzyme, you terminate the DNA chain, So they use it in treating what? Herpes simplex virus type 1 infections, herpes simplex virus type 2 infections, varicella zoster virus infections. Okay. So pharmacokinetics, you give it orally. Absorption, there's a high bioavailability. Distribution is widely distributed. Metabolism is rapidly converted to acyclovir. Excretion is just renal clearance. Okay. So therapeutic use. Used in treating herpes simplex virus infections like genital herpes. Used in treating what? Varicella zoster virus infections, commonly known as the shingles. It can also be used in what? Prevention of cytomegalovirus infection. So that one is not treatment, it's prevention, right? So adverse effect can cause headaches, can cause nausea, abdominal pain, and also fatigue. That's it for valacyclovir. So let's go on to the next drug. Now, for the next drug I'll be discussing, this is what is known as the zanamivir. So pharmacology of zanamivir. So you can see that zanamivir has a very popular brand in that some people used to even forget that this drug is called zanamivir. So the brand name is known as Relenza. That's the most popular brand name for this, So it's an antiviral drug. It's mainly used in treating what? Influenza A and influenza B virus. Okay, so it's a neuraminidase inhibitor. Okay, that's a class of zanamivir. So it inhibits an enzyme known as the neuraminidase. This enzyme is mostly found in influenza virus. Okay, the enzyme, right? What's the role of this enzyme? When the influenza virus makes other copies of itself, is the enzyme that will now facilitate that, okay, this copy is right, let's release it into the system. Do you understand? So is the neuraminidase that makes the infection to be spreading from one place to another. So if you inhibit the enzyme, it will stop the release of those newly formed viruses into the system. So you have the virus making copies of itself, but the virus is not able to release those copies. So this drug basically what keeps the virus in one place and stops the spread of infection. Do you understand? So administration is usually inhaled, right? It's usually inhaled. So influenza virus affects the respiratory tract. So I will inhale it so that it will function in the respiratory tract. I'm getting it. No need to put the drug into the whole system. It's just a particular system that is affected. I can reach this system via the nose. So I'll make the drug in a form that the person can just inhale. That's how pharmacology is. So absorption, it just goes into the lungs, so rarely does it go to the system. Okay, half-life is about 2.5 to 5 hours. So therapeutic use in treating uncomplicated influenza infections in patients. Once the patient is above 7 years, you can use this drug for them. Just like I told you guys, most antiviral drugs are just particular disease conditions. So this one is just influenza, you know. So adverse effect is cough, can cause throat discomfort, can also cause headaches. So we got. So I've been recording some for Instagram, so I think let me just pause that. It's enough. We're almost done. You guys shouldn't get tired though. Now we're quickly trying to move to the next drug, which we'll discuss its pharmacology. And this is what is known as the zidovudine. Pharmacology of zidovudine. So for the zidovudine, we said that it has a brand name, a popular brand name, which is known as the Retrovir. So it's actually one of the earliest antiretroviral drugs. It was developed for HIV and AIDS. It belongs to the nucleoside reverse transcriptase inhibitor. So they will block the nucleoside reverse transcriptase enzyme. Okay. So zidovudine is a thymidine analog. It's phosphorylated in the cells. That means you add more phosphate to it to make it triphosphate, right? So it will compete with the natural nucleotides. When it gets into the viral DNA, it will rather terminate it. Okay. So pharmacokinetics, usually give it orally. Absorption, oral bioavailability is good. Distribution is widely distributed. You know. So excretion is rare now. Half-life is about 1 hour. It's mainly used in treating HIV-1 infections. Okay, can also be used in preventing mother-to-child transmission. So adverse effects is headache, nausea, fatigue, insomnia. Can also cause bone marrow suppressions. So I think I'll just discuss the last drug. It's not the last drug, but they just announced that we have a class in class. We have a class in school, so I have to go to school, right? So this is what is known as the valganciclovir. The pharmacology of valganciclovir. So for the valganciclovir, we said that it's an antiviral drug. This one is mainly used in treating cytomegalovirus infections. So it's a prodrug of ganciclovir. So if I give you valganciclovir, it will ultimately be turned into ganciclovir. So it belongs to the antiviral nucleoside analog class. So it will be the ganciclovir will further be phosphorylated. You are adding more phosphate to it, okay, so that it becomes triphosphate. So it inhibits viral DNA polymerase, causing chain termination and blocking viral synthesis. It's active against cytomegalovirus infections and herpes virus infections. So administration is oral tabs, absorption high oral bioavailability, distribution is widely distributed, metabolism to be rapidly converted to gancyclovir. Okay, excretion is through the urine. So therapeutic use can be used in treating cytomegalovirus infection, generally like cytomegalovirus retinitis. So adverse effects: nausea, diarrhea, fever, headache, fatigue, and sometimes bone marrow suppression, leading to thrombocytopenia. So I'm actually still left with 4 antiviral drugs, but I have to stop this because I have to iron for school, I have to bath, and we have a lecture with the provost in my school, so I have to get there.